it's Olivia. Welcome back to your endocrinology chapter. In this section, we'll be talking about the adrenal glands. So we'll start out with going over some of the anatomy and physiology. We'll then talk about adrenal insufficiency, hypercortisolism, so what happens when you have too much cortisol, and then we'll talk about what happens when you have too much aldosterone. We'll go over some of the neoplasms associated with the adrenal glands, and then we'll talk about disorders of sexual differentiation that can occur as a result of problems with the adrenal glands. So first, let's talk about some of the anatomy and physiology of the adrenal glands that will really lay the foundation when we talk about some of these later pathologies. Now, the embryology of your adrenal glands is certainly going to be important because it would be fair game on step 1 for them to ask you about which germ layers different cells in your adrenal glands came from. So when we look down here at our picture of an adrenal gland, first, I want to point out this cortex. And the cortex is this outer layer of your adrenal glands. It is going to come from the mesoderm. So think about the cortex coming from the mesoderm, and then this inner layer, the medulla, is going to arise from your neural crest cells. So I don't think you need to know the process of embryological development of your adrenal glands for step 1, but definitely knowing that each of these 2 layers of the adrenal glands and which embryological germ layers they're associated with could definitely come up. So mesoderm for the cortex and neural crest will make the medulla. Now let's talk about some of the anatomy with your adrenal glands. So if you look over here on this picture, your adrenal glands, you can see, are sitting right on top of your kidneys. They are superior to your kidneys. And then, like we just talked about, they're composed of this cortex on the outside and the medulla as the inner layer. And then the blood supply to the adrenals is also going to be fair game for step 1. It's not pictured on your diagram, but if you can see your aorta continuing up here and then the inferior phrenic artery coming off of your aorta, the inferior phrenic artery is what is going to supply these superior adrenal arteries. So you can see these superior adrenal arteries coming down here, kind of branching off of this inferior phrenic, and that is going to provide the superior blood supply to your adrenal glands. Next, if we continue down your aorta, then we will see branching off directly from the aorta these middle adrenal arteries. So the superior adrenal arteries came off of the inferior phrenic artery that is a branch off of the aorta already, but the middle adrenal arteries are coming directly off of the aorta, and you can see them here supplying the middle part of the adrenal gland. Next, you can see your inferior adrenal arteries. So these inferior adrenal arteries are going to be coming off of your renal artery. So you can see first your renal artery is branching off of the aorta here. Your renal arteries are coming out and of course supplying the kidneys. But as they go on their way to supply the kidneys, they're going to have a few of these branches branching up to the adrenals, and those branches are going to be your inferior adrenal arteries. So that rounds out the blood supply of the adrenal glands. Let's quickly give some attention to the venous drainage of the adrenal glands, which is perhaps more relevant for step 1, given that there is a pathology here. So first, I want to let you know that the venous drainage is going to differ depending on which side we're on. So first, let's talk about the right side. On the right side, we have our right suprarenal vein, and this right suprarenal vein, you can see right here, is going to be draining directly into the inferior vena cava. Sometimes it'll drain into the right renal vein depending on if there's an anatomical variant, but for the purposes of step 1, it is more high yield to memorize that the right suprarenal vein drains directly into the inferior vena cava. That is going to be in contrast to the left suprarenal vein. If you look over here, this renal vein, this left renal vein, has to cross the aorta to drain into our inferior vena cava. Similarly, the left adrenal vein would have to travel quite a ways to make it directly to the inferior vena cava, and it doesn't travel all that way. Instead, it drains into the left renal vein, and then the left renal vein will drain into the inferior vena cava. Now, it's going to be important for you guys to understand that the left renal vein is longer than the right renal vein and actually has to cross the aorta to get to the inferior vena cava, because there's an important anatomical pathology here called nutcracker syndrome. Now, what is nutcracker syndrome? Well, as we've talked about, this left renal vein has to cross the aorta to get to the inferior vena cava. But as it crosses the aorta, there's another artery that comes down here, superior to the left renal vein, and that artery is the superior mesenteric artery. Now, as the superior mesenteric artery is coming off of this aorta and sandwiching this left adrenal vein, sometimes it doesn't leave enough room for the left adrenal vein to get through, and it can end up compressing the renal vein. This is usually on the left, and you can obviously see why. If this left renal vein is the one that is crossing over the aorta, it is the one that is most likely to get sandwiched, and as it gets sandwiched and compressed, the left renal vein is no longer able to drain the kidney, and this can lead to blood buildup in the kidney that can present with symptoms such as hematuria or flank pain. Certainly it can be painful if you're not getting enough venous drainage of your kidney, as well as pelvic congestion, usually in a female patient. And what do I mean by that? Well, another difference between the venous drainage between the left and right sides is that on the left side, the left gonadal vein also drains into the left renal vein before emptying into the inferior vena cava. On the right side, sometimes it'll just empty into the inferior vena cava directly. But on the left side, if we have our gonadal vein that is supposed to be draining into our renal vein, and then our renal vein is compressed and not draining at all, then we can also get buildup of blood in the gonadal organs that the gonadal vein drains, and this can certainly lead to pelvic congestion syndrome in the female, and that'll present with a swollen labia or extra swelling in that region. So nutcracker syndrome is a very important anatomical tie-in to be aware of, but let's talk about more of the physiology of our adrenal glands. And to do that, I like to zoom into this picture down here. So we already talked about how we have the cortex and we also have the medulla, and each of these different parts of our adrenal gland is going to be responsible for making different hormones. Now first, let's just talk about the cortex. Now the cortex is divided up into 3 different layers. Each of these individual layers is going to secrete different hormones, and I like to remember which hormones each layer secretes with the mnemonic go find Rex, make good sex, and we can talk about what this mnemonic stands for as we go through this image. So first on this image, I really want to point out how you can see the different layers in this histology slide. So looking at this histology slide, you can kind of see that there are different transition points between the layers, and you don't have to be exact on this, but if I'm just looking at this picture, I can see that maybe we have one layer that ends here, maybe there's another change in cell type somewhere around here, and then down here certainly you can see another differentiation in cell type. And I usually look for different color, different cell sizes, and there should be pretty clear demarcated transition points for you to be able to identify. But then what are each of these individual layers? Well, the first 3 layers are going to make up our cortex. This last layer is going to make up our medulla, and we'll start out talking about our cortex layers. First of our cortex layers is the zona glomerulosa, and the zona glomerulosa is what the G is going to stand for in our mnemonic. The zona glomerulosa is this top layer. It is going to secrete mineralocorticoids, so that is what the M stands for, and one of the key mineralocorticoids it secretes is aldosterone. And if you remember aldosterone, it's incredibly important to our RAS system, our renin-angiotensin and aldosterone system, and this is where the aldosterone comes from. So it comes from the zona glomerulosa, which is in our cortex, which is secreting mineralocorticoids. Now, our second layer of the cortex is going to be your zona fasciculata, which is what the F stands for in our mnemonic. The zona fasciculata is going to produce glucocorticoids, which is what the G stands for. And some examples of important glucocorticoids are things like cortisol or corticosterone, cortisone. So if you remember back to some of our anterior pituitary and hypothalamus lectures, our hypothalamus is going to secrete CRH. This is going to travel to our anterior pituitary. Our anterior pituitary will secrete adrenocorticotropin hormone, and then adrenocorticotropin hormone travels to that adrenal cortex. And we're finally down at the level of the adrenal cortex now, and we know that in the adrenal cortex, it is going to be our zona fasciculata that is going to be producing these corticosteroids. And then the last zone of our cortex is going to be the zona reticularis. That's what the R stands for in our mnemonic. The zona reticularis is going to produce androgens or male sex hormones. That is what the sex stands for in this mnemonic. This is pretty low yield for you to memorize all of the different androgens. They definitely don't come up as much, but if you just know that the zona reticularis is going to be responsible for making some androgens that are male sex hormones that can stimulate masculinization, you'll be in good shape for step 1. Now finally, our adrenal medulla is going to be responsible for producing our stress hormones. It is going to be stimulated by our sympathetic nervous system, and it is going to be releasing epinephrine and norepinephrine, which of course can increase your heart rate, increase your blood pressure, very important hormones in the body. So to quickly recap what we learned about in that diagram, we first talked about the cortex. The cortex, of course, comes from the mesoderm. The cortex is responsible for production of our mineralocorticoids, of our glucocorticoids, and then, of course, of our androgens, and it's going to be pretty high yield for you to be aware of which layer each of these comes from. So going back to our mnemonic, go find Rex, make good sex, our zona glomerulosa is going to go with the mineralocorticoids, our zona fasciculata is going to go with the glucocorticoids, and then our zona reticularis is going to go with the androgens. Next, we talked about the medulla. The medulla is going to be responsible for production of our stress hormones like epinephrine and norepinephrine. The medulla comes from our neural crest cells. And usually what happens in this pathway to stimulate our medulla to release these stress hormones is the celiac ganglion is going to give a signal to some sympathetic nerves. The sympathetic nerves are going to innervate the medulla, and the medulla is going to release epinephrine and norepinephrine. Now, one important note about the medulla, these neurohormones are secreted by chromaffin cells, and sometimes it will be important for you to know which cells specifically are secreting these hormones in the adrenal medulla, because you could get asked about it on step 1. Let's quickly recap what we talked about in this video. First, I really want you to be aware of this venous anatomy. So just remember that your left adrenal vein as well as your gonadal vein are also draining into the renal vein on the left before they are draining into the IVC, and this renal vein can get smushed by your superior mesenteric artery, resulting in nutcracker syndrome. Additionally, I want you guys to remember this mnemonic that we talked about: go find Rex, make good sex. So your glomerulosa is going to make your mineralocorticoids, your fasciculata is going to make your glucocorticoids, and then your reticularis is going to make some of those androgens or male sex hormones. And if you can just remember the order of these layers going through the cortex and then the medulla, and which hormones each of these layers secrete, you should be in good shape for step 1. Now, how would they ask you about this on a board style question? Well, something they might ask you is, a 26-year-old woman presents to her PCP for increased swelling of her labia. The patient is not sexually active. She also endorses worsening lower back pain for the past week, worse on the left. Ultrasound reveals compression of the left renal vein. What structure is most likely causing this compression? Okay, so this is a patient, a 26-year-old woman. She is not sexually active, but she's having this labial swelling, and she's also having what sounds like some CVA tenderness. This is a classic presentation for nutcracker syndrome. She could definitely be having some pelvic congestion, given that the gonadal vein on the left drains into the renal vein. She's definitely having some flank pain, and we could, of course, test her for hematuria, but if we already have the ultrasound that is showing some compression of this left renal vein, we're pretty sure it's nutcracker syndrome. And then the question asks us, what structure is most likely causing this compression? Well, we talked about the superior mesenteric artery smushing down the left renal vein and causing nutcracker syndrome. So because you watched this video, you would know that that would be the answer and you would get that question correct. Now that's all I have for you on adrenal gland physiology. Thanks for watching this video, and I'll see you next time.